Right, in the next two lectures, we are going to take a look at our 6 muscle groups. So in this lecture, we're going to take a look at the first 3 groups, that is head and neck muscles, vert column, anterior thorax and abs, and then pectoral girdle and arm. So we're going to start by looking at the muscles of the head and neck. There are 2 muscles that make up essentially your scalp muscles, or the top of your head. And that is your frontalis, or the frontal belly, and then the occipitalis, or the occipital belly of the occipitofrontalis muscle. Typically, we talk about them separately. They are connected via this epicranial aponeurosis, and aponeurosis is basically a flat piece of connective tissue, tendon-esque, that usually is connecting muscles. So your frontalis muscle is basically your forehead, and that's responsible for raising your eyebrows as well as wrinkling your forehead. So as we go through and you are studying these muscles, you want to make sure you're doing the actions as you study them. That is literal muscle memory to help you. So frontal belly, wrinkling the forehead and raising the eyebrows. Your occipital belly, or the occipitalis muscle in the back, basically kind of retracts your scalp. In other words, it provides the tension to hold this aponeurosis upon the top of your head. We're going to look at several muscles that control facial expression. So even those 2, especially your frontalis, contributes to some of those facial expressions, when you wrinkle your brow or raise your eyebrows in shock. The next muscle in group 1 that we have you identifying is your corrugator supercilii, which are these small muscles located here near your eyebrows. They are also responsible for a bit of wrinkling your brow. Basically, it's going to pull that forehead as well as your eyebrows, kind of in that pinched way. Again, in a quizzical look, or if you're uncertain about something, that would be what your corrugator supercilii would be responsible for. Then we have our orbicularis oculi. So we have some of those sphincter-esque muscles, so circular muscles, and we'll have 2 of those on the face, one around the eyes for oculi and one around the mouth. And obviously, these muscles are going to be responsible for squinting, blinking, closing your eyes. They're going to cinch close that skin around your eyelid. You'll note in your packets that we have provide you with a space for origins and insertions. I'm not requiring you to know them, but sometimes they are helpful in figuring out what the action is, because muscles only work in that one way. They only pull, they don't push. All right, so our blinking, our squinting, our batting our eyelashes, all of that is orbicularis oculi. Next muscle on your list are the zygomaticus muscles. We're going to talk about them as one. So there is a major and a minor, and that are these 2 rope-like muscles going across, connecting to the zygomaticus bone, so connecting to that cheekbone, all right? But notice that they're also inserting into the muscles in the skin around the lip. And so that is basically what makes you smile. So your zygomaticus bones provides you with that lifting of the upper lip and provides you with that raising of the corner of your mouth. So you're smiling because of those cheek muscles, those zygomaticus muscles, both major and minor together. Next is your risorius muscle, and that is this skinny muscle here. I'm going to jump back to this other picture. Oh, I think they'd cut it off on that one. So we'll stay here. So it is a thin muscle that essentially is right on that corner of your mouth line. And it basically pulls your mouth flat. So when you kind of do that, that's how I usually remember it. When you kind of push those lips together and kind of contemplate life, that would be your risorius muscles pulling, and you will have one here, and you will also have one on the opposite side as well. Then we have the levators and the depressors doing exactly what you think they would do based on their names. Levator meaning elevate, depressor meaning to depress. And we have first your levator labii superioris. So there are actually 2 levator muscles. We're only going to look at labii superioris. So those are these muscles right here, all right, on the thicker side, your levators, and the levators are the Elvis muscles. That's how I like to remember them. They elevate the upper lip. And since you have one on each side, you can elevate each side of the lip. So my My levator on my left side is the only one that actually does the does the Elvis thing. I can't, I mean, try it right now. I'm going to, but it's embarrassing. Like the one on my right side just doesn't do it. Some people can do both. So if we were in class together, that's what I'd be having you kind of show off your levator skills. But that's something to try and see which one of your levator labii works. So your levator is your Elvis muscle there on the upper lip. And then we have you identifying two depressor muscles. So first, labii inferioris. So depressor labii inferioris, again, kind of a thicker muscle mirroring your levators. So one on each side here in your chin, and that's going to be pulling down on your lower lip. So these muscles are going to be responsible for like a pout. So when that lower lip gets pulled down, that pouting face is going to be your depressor labii inferioris. Then you'll notice you also have a depressor anguli, anguli meaning on an angle, all right, oris, and that is located here. And then you also you would have another one over here on this side. But again, that's going to be essentially part of that pout, right? Pulling down the corners, especially of your lips. So it's more than a pout when the depressor anguli oris gets activated. It's more like that tragedy grimace, all right? That really, oh, so terrible. That really devastated, pulled down corners of your mouth. So again, levators elevating and depressors pulling down on that lower lip or the corner of your lip if you're on that angle, okay? All right, then we have just a couple more, really two more that are facial expression or orbicularis oris. So that would be obviously the muscles that surround our lips. And they are going to be responsible for pursing our lips, right? Closing our lips, compressing our lips. And so this would be like you're kissing, all right? So you're going to be able to kiss or purse your lips, do part of your duck face or selfie face with your orbicularis oris muscles, okay? And then lastly, for facial expression, you have the mentalis. Let me see if I've got it on this side. I think they have them all cut. So the mentalis muscle here is actually going to cover, so you can see part of it here. It's actually going to cover this whole section of the chin. I don't think I have it on my other faces. Let me just double check. Yeah, no. So your mentalis muscle is going to cover in this space right here. And that's going to be like, it's going to wrinkle the chin. It's going to protrude that lower lip. So again, it gets into that pouty face. It gets into, I always think of, this is an old show now from Showtime, but Homeland, the character of Carrie, she's like the worst ugly crier in the land, or like Kim Kardashian, like they have those really ridiculous ugly cries and their chin and their lip just goes like crazy. And that's the responsibility of the mentalis muscle on the chin. So those are muscles that are primarily responsible for facial expressions. As we transition from facial expression into mastication, mastication means to chew. We have a couple muscles that are going to be responsible for that. So the first of those muscles is going to be what's called the buccinator muscle. And that's going to be these very large muscles that go on the sides, each side. And you can see that hidden underneath here as well. But there's a little bit better view, removing some of those other muscles. And that's going to compress your cheek. So this is going to be like when you, like a baby suckling, drinking out of a straw, or whistling. So again, that kind of fish face, that duck face, posing or really compressing and pulling in your cheeks. That's going to be your buccinator. And obviously that's important not only for drinking, but in some of the parts of mastication and chewing as well. All right, last couple here. You have a very important, very strong muscle called the masseter muscle. That's located here. You can see it very largely going from your zygomatic and temporal bones all the way down to your jaw. This is your primary, one of your primary jaw muscles, and its job is to elevate the mandible. The mandible, remember, is our lower jaw. And this muscle is our prime mover to be able to close the jaw. So obviously important in chewing. We utilize our masseter muscle to do that. So if you open your jaw and you put your hands on either side, you can feel your masseter muscle contracting when that jaw closes. It has an assistant or a synergizing muscle, and that's this very large fan-shaped muscle called the temporalis. So again, if you put your hands on your temples and you open and close your mouth and you feel that closure, you'll also feel a contraction of that temporalis muscle on the side of your head. This muscle also is responsible for kind of holding our jaw in place, so kind of stabilizing when it's at rest or when it's closed. All right, last but not least, we have one neck muscle that you are responsible for knowing, and that's the sternocleidomastoid, named for its multiple connections. So it has two origins on the sternum and the clavicle, and then it inserts on the mastoid process of the temporal bone. But it's a very large muscle of the neck, and it's responsible for a couple different things. So you have one on each side of your neck. I don't know if it shows you, no, because we have the platisma there. Let me see here, sternocleidomastoid. So you can see here, just without everything else in the way, you can see it's very large rope muscle, but it is going to be on both sides. So you'll have one on each side. When they work together, they are responsible for neck flexion. So when both of them are contracting, they're responsible for neck flexion. If only one or the other is operating, that's going to allow your head to flex to the shoulder. So when you kind of tilt your head from side to side, that would mean one of the two is going to be is active. And also, oppositely is going to allow us to pull our head from side to side, or that rotation from side to side as well. So those are our first group of muscles, that is head and neck. Your next group of muscles is kind of a bit of a hodgepodge. We have a few on the vertebral column, a couple on the anterior thorax, and then our 4 abdominals. So I'm going to take a look at our vertebral column muscles first. And those, the muscles you're responsible for knowing for the vertebral column are going to be the erector spinae muscles. And these are postural muscles. So these are 3 long rope-like muscles broken into different sections that run along your vertebral column on your posterior side. And that allows you to do extension of the spine. So again, to hold good posture, as well as to do some flexion. To do some flexion of the vertebral column. So you want to get in that jazzercise, your erector spinae are going to be involved there. There are 3 muscles that are responsible for that, and they are your iliocostalis, your longissimus, and your spinalis. And what you can see here is that each of these muscles have different sections to them. You are only responsible for knowing the whole muscle itself. So while they are broken up into these different pieces, a head portion, maybe a neck portion, a thoracic portion, and a lumbar portion, just like our spine is broken up into those pieces, you are only responsible for knowing them as a whole. So I like to go from, what's my ILS? I like to go ilio longissimus spinalis. So ILS or, SLI if you want. If you want to do SLI or if you want to go ILS, it's up to you. But if you were going lateral to medial, it would be the iliocostalis, the most lateral, the longissimus being in the middle of the two, and then spinalis is the one closest to the spine, right on the midline almost of the body. So all of these muscles together are postural. All of them are involved in extension of the vertebral column. You do have a couple, not a couple, but the longissimus here, just want to make sure I'm not forgetting anything. That's why I keep checking my notes. The longissimus capitis, so the longissimus portion has a head piece as well. You'll notice the other 2 are only spine, so cervical down, but it has a head piece. So it's also involved in some of the head extension as well. But they are grouped together as the erector spinae. So typically they're commonly talked about as one group, but they do function individually as well, right? And we'll see a lot of different groups as we make our way through the body there, right? Okay, I'm going to skip this one. I need to get us a view. It's not the best view, but let me see. There we go. Perfect. All right. So we have a couple of different muscles of the anterior thorax, so of our chest, that are involved in breathing primarily. So they're going to be interwoven between our ribs. That's going to be our intercostal muscles. Inter meaning between, costal relating to the cartilage that connects our ribs to our sternum. And then we are going to have our diaphragm. Okay, so your external and internal intercostal muscles. So you can see here, your externals are going to run on an angle kind of shoulder in. And then your internal intercostals, that would be all of these muscles here, are going to run medial. So, kind of sternum to hip. All right, on an angle that way. So the fibers are running in different directions, and that's because they're going to do slightly different things, okay? Your external intercostals are going to elevate your rib cage, all right? So the elevate, external, elevate. So external intercostals elevate the rib cage, meaning it provides more space, and that means they're going to aid in inspiration. When you breathe in, you are using your external intercostals to make more room inside your lungs. Your internal intercostals, on the other hand, are going to depress the ribs. All right. Now, technically speaking, expiration is a passive process unless you force the expiration. So when you breathe in, your external intercostals, as well as your diaphragm, are going to relax when they're done contracting. And that's a natural process and requires no energy. But if you are breathing out, if you're like huffing and puffing because you're working out, or maybe you're blowing up a balloon, you are forcing that expiration. And so your body needs to squeeze that rib cage even smaller to force more air out. And that's what the internal intercostals do. All right. They depress the rib cage and they aid in that forced expiration. But I would say your most important muscle for inspiration, for breathing, it's the prime mover for inspiration, is called your diaphragm. And so obviously this is a superior view. So this is like if we had a hamburger bun and we took the top off and we're looking at the hamburger underneath. All right. So we're looking down on our diaphragm. Here's our vertebral column. So this is our posterior. Here's our xiphoid process or sternum. Your diaphragm sits right below the rib cage, and it kind of is this very flattened, almost tent-like muscle that sits underneath there. And when the diaphragm contracts, it's going to flatten out. And by flattening, again, that creates more space inside your rib cage so the lungs can inflate, air can move in. Changes the pressure differential in there, all stuff we'll talk about later this semester. It also, because of that flattening, compresses some of the abdominal cavity as well when it contracts, obviously, because it's pushing down in that area. Again, those of you who are singers or athletes, or actors, very familiar with the diaphragm and its role in being able to increase your lung capacity by being good at its job. All right. And lastly, for group 2, we have 4 abdominal muscles. All right. 4 abdominal muscles that we are responsible for knowing. That is the rectus abdominis, the 2 obliques, external and internal, and then the transverse abdominis muscle. So first and foremost, you are going to have a huge piece of connective tissue that sits on the outside of your abs as well. The most superficial of the ab muscles is your rectus abdominis muscle here. This is what people commonly refer to as your 6-pack or 8-pack or 12-pack or whatever, 24-pack or depending on your activity level. But this is what you're doing those sit-ups and those curls for, okay? The whole purpose of your rectus abdominis has a couple of functions. One, it helps to depress your ribs. So it's also going to be involved in some of that forced expiration. It obviously compresses the abdomen. But it's also going to be involved in some flexion of the vertebral column, right? So think of when you do a sit-up, right? You're curling that body in, and so you're able to flex that spine, the vertebral column, due to your rectus abdominis. So again, you're doing those sit-ups and those curls to work that rectus abdominis muscle. When we talk about your core, all right, these ab muscles, your rectus, your transversus, and then these obliques, that's what you're looking at when you talk about core muscles or core activities. Your 2 obliques do the same thing, all right? In addition to compressing the abdomen, right, providing tension there, they also are involved in that depression of the ribs, so part of that, that forced expiration, and then that flexion and that bending of the spine. So obviously when you're doing like Russian twists or again, any of those other exercises, your side planks, things like that, and twists with that, will get into your obliques. And again, you have external obliques, and then you have internal obliques. So here's your external obliques located here, and then you have your internal obliques deep to that. We'll get a nice look at that, hopefully, when we dissect our minks, and you'll be able to peel away these different layers of the abs. Eventually, we get into a deeper layer here. Right, this is showing you your 3-layered here. But if we were to cut away a piece of our internal oblique here and our rectus abdominis, deep to those, what you would find here is the transverse abdominis muscle. All right, and this muscle is almost entirely responsible for compression of the abdominal cavity. So it provides us with with that security for all of our abdominal organs that are located within. So the combination of those 4 layers, your rectus on that superficial anterior side, and then you'll find those external, internal obliques primarily laterally, and then deep to those, you're going to find that transverse abdominis, again, cinching in and compressing the abdomen. And that takes us through group number 2. One more group to go, peeps. We got this. Group number 3 takes us into the pectoral girdle and to the arm. All right, takes us into the pectoral girdle and to the arm. Yes, I will go here. Perfect. So as we head in here, now we're starting to get into a few more muscles that are in a group. We'll look at one more group of muscles today. And then some of the muscles that are responsible for a lot of our upper body strength. So, you know, climbing and pushing and swinging and throwing and things like that. We're going to get into those muscles. So first 2 on your list here are pec minor and serratus anterior. So the pectoralis minor is a deep muscle. Always good to recognize superficial versus deep. So it's a deep muscle, and you can see that flanked out here. And again, you would have 1 on each side. Responsible for depressing and protracting. Remember, protraction, pushing forward versus retraction, pulling back. So it pulls down and pulls forward our scapula or our shoulder, all right? That allows for the scapula to kind of rotate and bring our glenoid cavity down a little bit, all right? So again, it provides us with some of those motions that are going to start to get us utilizing our shoulder, and that will add in those rotator cuff muscles at the end of today, all right? So that's your pec minor, and again, you have 1 on each side. Then you have your serratus anterior muscles, which you can see here, all right, branching on each of these ribs. So you have several of those serratus anterior muscles. Again, woven in and out. You can see them also located here. All right, your serratus anterior. This is going to be another protractor muscle, protracting that shoulder. So this is the prime mover for that, while the pec minor synergizes with that. This is commonly referred to as the boxer muscles. So punching and some abduction of that shoulder and moving that arm up. So any of these motions, and again, obviously we have several muscles involved here, but your serratus anterior being the prime mover for pulling that shoulder forward to allowing that glenoid cavity to tip down so that that shoulder is going to be able to rotate. So again, punching, pushing, any of those movements will be the serratus anterior leading the way. All right. On the posterior side, you have a very large triangular shaped muscle that runs a good chunk of your neck, your upper back, and then down most of your vertebral column. And that's your trapezius muscle. All right, that's your trapezius muscle. It's, shrugging is what I think of when I think of the traps, right? It's going to elevate my my scapula. It's going to stabilize it because of its triangular shape. It's going to retract that scapula as well. In other words, it's going to pull it towards the midline versus, so adducting the shoulder versus moving it away. All right, so that shrugging, that pulling in, that adducting of the shoulder is going to be the trapezius's thing. So a lot of times when you're lifting weights, obviously trap muscles are going to be involved along with our pec major, which we are going to flip around and look at right now. So anterior to that, you have the pectoralis major muscles, which are your 2 primary chest muscles on both sides. You can see it cut here, but in its very large, fan-shaped convergent arrangement here as well. This is your prime mover for arm flexion, all right? So your arm is able to flex. Your arm is able to, kind of decrease that angle due to your pec major muscle. It's also responsible for medial rotation, so rotating the shoulders medially, so towards the midline of the body, as well as adduction, because those 2 actions, medial rotation and adduction, kind of go hand in hand. Pec major, obviously, if I am climbing, if I am throwing, if I am pushing, all of those types of things, my pec major are going to be involved in. Simultaneously, you also have, not simultaneously, but in cahoots, You also have another shoulder muscle that is large and important, much like your traps and your pec major, and that's the deltoid. And the deltoid's kind of like your shoulder cap. So these muscles here that sit on the top of both shoulder, and it is the prime mover for arm abduction. So being able to move my arm away from my body is the primary motion of my deltoid. It also has some additional obviously the idea of decreasing that arm angle. So being able to flex my arm, the deltoid's involved in medial rotation, the deltoid's involved in, and then it also has a posterior portion. You can see that's the posterior portion of the deltoid, and that's also going to be involved in lateral rotation and extension. So because the deltoid has this anterior portion and a posterior portion, it's able to do, and it's located on opposite sides of the bone, it's able to do opposite actions. It's able to flex the arm, but also extend. It's able to abduct the arm, but also, medial rotate the arm and laterally rotate the arm as well, which is pretty cool. Not a lot of muscles can do that. All right, last large muscle, and then we'll take a look at our group, is our latissimus dorsi, which is this huge back muscle that wraps around underneath on the lateral portion of our body. So your lats are going to kind of come up in here, but it's this very huge, large back muscle, latissimus dorsi, and this is your prime mover of arm extension. So being able to extend out my arm is going to come from my latissimus dorsi muscles here. Also, it is going to play a huge role in medial rotation of the shoulder, so being able to move my shoulder forward, as well as some adduction. But it's commonly referred to as the power stroke muscle. So anytime you are, you're chopping wood, or you're hammering something, or you're throwing something down, you're rowing, you are swimming, especially like the butterfly, or, really any swim, stroke would be that. But you are bringing that arm down in this kind of powerful way. That's going to be your lats. So this is something that, baseball pitchers can end up doing damage to, because of that throwing motion with so much force behind it. It's a muscle that they have to be very, very careful with as well. Okie doke. Last but not least, our last group of muscles that we will be taking a peek at are our rotator cuff muscles. All right. Sorry, I'm just trying to see what's our best view here, but we'll keep supraspinatus on right now. So there are 4 muscles you'll notice on your list, 4 muscles that have asterisks by them, and they make up what we commonly refer to as your rotator cuff. You have no muscle that is called the rotator cuff. You have 4 muscles that make up the rotator cuff muscles. And this goes to that idea that you have to have a lot going on to protect your shoulder, all right? Because we've talked about the anatomy of that shoulder. It needs a lot of muscles to keep it in place. So the supraspinatus muscle, you can see there on the posterior side of your shoulder. All right, so you can see that supraspinatus muscle here, and that's going to be one of your primary rotator cuff muscles. It is going to be an abductor for the shoulder, right? And it's also going to, as many of the rotator cuff muscles do, what they prevent, what their job is to stop the shoulder from being dislocated in a downward fashion. So in other words, it's going to hold and make sure that that humerus stays in place in that glenoid cavity, in addition to providing rotational movement. So the supraspinatus is going to allow for that abduction. So it's going to begin the movement away. And that's part of the initiation of rotation, is we have to move that shoulder away from the body. All right. So supraspinatus, one of your 4 rotator cuff muscles. All right. You also have the subscapularis, so that's a very large muscle on the anterior side of the scapula, and that is your primary medial rotator of the humerus, okay? It is the major muscle that's going to provide that medial rotation, so originating on the medial side and then pulling on that lateral side as well, okay? You also have, here we go, you also have 2 other muscles that are part of the rotator cuff group, and they do the same thing. That's your infraspinatus, so below the spine, again, posterior now. And then your teres minor, which is located right here. So these two muscles, again, are responsible for rotation, this time lateral rotation. And that's because they're on the posterior side there. They are going to be responsible for lateral rotation as opposed to the subscapularis, which is on the anterior side. It's going to be responsible for medial rotation of the shoulder. All right. So just to recap here, subscapularis, medial rotation, anterior side. Infraspinatus, teres minor, lateral rotation, posterior side. And then supraspinatus, initiation of abduction. So kind of starts us out because it's located superiorly. There's also another teres major, or excuse me, another teres muscle, and that's the teres major. It's technically not a rotator cuff. It's actually going to work with your lats, with your latissimus dorsi, and be involved with extension and adduction. But it also does play a role in some medial rotation, and that's because it wraps around to that, you can see, anterior side of the humerus as well. Those are your muscles of your first three groups.